Welcome to Practice Insights. I'm your host Suresh, and today we are going to talk about something absolutely vital in neonatal care: hand hygiene in the NICU, and specifically how to practice it effectively using ESLOC-CHG, a chlorhexidine gluconate 20% surgical scrub. When it comes to preventing infections in the NICU, our hands are the most common vehicles for transmission. Even the smallest lapse in hand hygiene can place fragile newborns at serious risk. That's why surgical hand scrubbing is non negotiable for every healthcare worker stepping into a neonatal intensive care unit. Let's walk through the why, the how, and the best practice method. Why hand hygiene matters in the NICU. Neonates, especially preterm infants, have immature immune systems. They can't fight off bacteria, fungi, or viruses the way older children or adults can. Even minor contamination can quickly progress to life threatening sepsis. That's why proper hand hygiene, done consistently and correctly, is considered the first line of defense against hospital acquired infections in NICU. Why use SLOC? CHG? It contains 20% chlorhexidine gluconate, a powerful antiseptic. Chlorhexidine provides broad spectrum antimicrobial activity, covering gram positive and gram negative bacteria, fungi, and even enveloped viruses. It has a residual effect, meaning it keeps working on the skin even after rinsing, and it's gentle on skin when used correctly, making it suitable for frequent scrubbing in busy NICU. Step by step surgical hand scrub method. Now let's go step by step through the recommended scrub technique with SLOC. CHG dispense 5 to 10 milliliters of SLOC. CHG surgical scrub into your palm. Wash hands and arms thoroughly. Pay attention to nails, cuticles, and skin folds. Clean subungual areas. That's the space under your fingernails. Using a sterile nail file or brush. Germs love to hide here. Scrub each side of each finger, between the fingers, and the back and front of both hands. Don't forget the thumbs, which are often missed. Move up the arms, scrubbing all surfaces while always keeping your hands higher than your elbows. This prevents water from running back from the less clean arm to the hands. Continue scrubbing for a total of 3 minutes. When it's time to rinse, do so for another 3 minutes. Pass your hands and arms through the water in one direction only, from fingertips down to elbows. Never go back and forth. This method ensures that microbes are flushed away and not reintroduced onto the hands. Key points for NICU practice. In the NICU setting, consistency is everything. Here are some reminders. Perform a full 3-minute scrub before the start of duty, before any sterile procedure, and after any contamination risk. Always remove jewelry, watches, and rings before scrubbing. They harbor microbes and interfere with cleaning. Dry your hands with a sterile towel after scrubbing. Remember, alcohol based rubs are useful for routine hand hygiene, but for entry into the NICU sterile zone or for performing procedures, surgical hand scrub with E is mandatory. Safety and compliance using SLOC. CHG is safe when directions are followed, but here are a few safety tips. Avoid contact with eyes, ears, or mucous membranes. Do not swallow. If irritation occurs, seek medical advice. And remember, proper technique is just as important as the product you use. Cutting short the scrub time or skipping steps reduces its effectiveness dramatically. So, to summarize, hand hygiene in the NICU is not optional, it's life saving. You get a reliable, broad spectrum antiseptic that, when used correctly, provides effective and lasting protection against harmful microbes. By following the 3-minute scrub and 3-minute rinse protocol, you help create the safest possible environment for our tiniest and most vulnerable patients. That's it for today's episode of Infection Control Made Simple. Thank you for joining me, and remember, every scrub counts. Your hands can either transmit infection or they can stop it. The choice is in how well you practice hand hygiene.